Good morning. My name is Jim Dice. I'm one of the registered nurses here with Twin Oaks Home Care. And today we're going to be discussing our spring mandatory staff meeting. Today's April 3rd, 2012. It's about 11 a.m. We always start with policy reviews. And we always start with call-offs. So at this time I would like to just say that our call-offs over the last 6 months have actually been decreased. We've had a significant decrease in call-offs, and we really appreciate that. Employees have been doing a very good job of being dependable. That makes our lives less stressed. And what I just want to mention about the call-offs, though, is please keep in mind to try and give us as much a notification as you possibly can if you know you're not going to be able to make your shift. Our policy states that we're to have an 8-hour notice. That allows us to stay dependable. That allows us to find someone else to help cover a shift. Also, one more thing regarding call-offs. We need to have your written slip into the Hopwood office within 3 business days after a call-off. That's important because it's not counted against you, and we need to get that information and get it into your file. Special requests. Please remember that we've got summertime coming up here. People are going to need some time off to enjoy their family, to enjoy vacations. Those are given on granted on a first come, first served basis. Those need to be, again, 14 days at least in advance. And we just want to remind employees, now's the time to go ahead and put in for your vacation request for this summer, although it's April. Letter C. Notes in patients' homes, just a reminder, those notes must be pre-approved by the office. We are not to be writing notes in patients' homes without the office knowing about it. Also, if there's any old notes that are in the home that no longer apply, you need to get rid of those. Give the office a call, and we'll review those, and we'll make sure those get removed out of the house. D. Time signing in and out. We have always had this stance, but I need to make you aware of some new laws that are actually in effect. Our times, that we schedule employees are either at 00, 15 minute, the 30, which is half past an hour, or 45 minutes. Those times must remain accurate. If you're given a schedule from 10 a.m. to 1 p.m., then you need to sign in at 10 a.m. and sign out at 1 p.m. Unless there's something that changes. If there's something that changes, like the patient has a dirty diaper 10 minutes till before you're ready to leave, and you're there till quarter after, all that takes is a phone call to the office to say, I'm going to be here until 1:15 instead of 1 o'clock. That's not a problem. Problem is when a patient may send an employee home a half hour early, and the employee goes ahead and signs out at their regular time. Well, that's considered fraud. That's considered stealing. I shouldn't even have to tell people that, but I'm going to. It doesn't happen all the time, but to be honest with you, it's probably only happened once or twice in the last year. But I need everyone to understand, one time is too many times for that to happen. The line is already drawn in the sand. It is not acceptable. It is a criminal offense. And what can happen is if a patient sends someone home early, they sign out a different time than when they actually left. They got paid extra. We actually billed that to the state. The state, if they find out about that, can actually press criminal charges against the employee. I'm trying to keep my employees out of jail by letting them know this is not acceptable. Don't ever let it happen. Make sure that you're contacting the office. If there are difference in time changes, it's important because we don't want to overbill. We don't want to underbill. We don't want employees to not get paid for exactly what they do in the same regards. So it is important, and it's something that we review pretty much every staff meeting. Your times must be accurate. There are no exceptions. E, when calling times in and out, this must occur from the patient's phone, not your cell phone. When you're in a home and there's going to be a time change, that phone call needs to take place from the patient's phone. That way it gets registered here on our call history. That does not get called in from your cell phone. So if they're going to send you home early, you're scheduled till 1, they're sending you at 12:30. You pick up the phone before you leave that patient's house at 12:30 and you call the office. It's that simple. F, just a reminder, there is a fine for any employee that picks a patient up off the floor. We are not permitted to pick patients up off of floors. The fine right now is still $200. It has not happened since we instituted this about a year ago. And that's a good thing. We have avoided any employee picking a patient up off the floor in a year. So thank you, everyone. Keep doing a good job in that regard. G, incident reporting. We have to cover this every spring. It's important for employees to know what an incident is. An incident is plainly an undesired effect, if you think about it. Your desired effect is for the patient to go from the bed to the chair. Well, in the meantime, they're using their walker, it gets caught on something and they fall down. That's not the desired effect that we had. That's an incident that gets called into the office. Now, incidents could also include injuries of any type, either to the patient or to an employee. Incidences also include changes in a patient's condition. The only thing I want to say about this is if a patient's having chest pain or if a patient is short of breath on a Saturday at 2 o'clock, don't wait until Monday at 1 o'clock to decide to call the office and say, oh, by the way, someone was having chest pain and shortness of breath on a Saturday. To my knowledge, that's not happening. I kind of feel like I want to say that and throw that out there to all the employees to let them know I don't ever want that to happen. It's being able to prioritize patient safety, patient changes in their conditions. Those come first. That's a huge safety measure. If someone needs help, I want to get them help now. I don't want to wait a week before they get what they need. Okay? Let's move on to number 2. Number 2 is home care safety. There's nothing more important than we do than to keep patients at home and keep them safe. So if I could have everyone understand the importance of hand washing, 99.9% of the time, infections can be prevented by simple infection control techniques. The most important one is hand washing. The other one would have to be covering our mouth whenever we cough or sneeze, or if we touch our face, to make sure that we wash our hands. Those are so important. A lot of times, we're touching things that are dirty, they're contaminated. We're helping them with their wound care. We're helping them take out their garbage. We're helping them to the bathroom. Please, please, please wash your hands frequently. It's summertime now. We shouldn't need as many lotions on our skin. It's not going to be as dry out as it has been over the winter time. So we're not going to have the dry, cracked hands. But if that's the case, go ahead and use the lotions. But make sure that we're washing our hand when we come in, when we leave, before any meal, after we help anyone toilet, before and after any wound care. If we're helping, around the house, taking garbage out, those kind of things are really important. Let's go with letter B, the principles of body mechanic. The second most important thing, the first thing is let's prevent injury to the patient. The second most important thing has to be let's prevent injuries to any employees that are in the home. And there are things that we have to do. We have to be educated to the point where This is how we handle these situations. This is how we reduce the risk of these injuries occurring. And there are some principles of body mechanics that are really important for everyone to understand and for everyone to know to eliminate the risk of them hurting themselves. You know, I was new in the nursing profession. I had lifted a big filing cabinet and had carried it, didn't know that the drawers came out of it, and I pulled something in my back, and for about 3 months I would go to work, I would come home, and I would lay on the floor. I wouldn't be able to enjoy my kids, my family. I wasn't able to do anything outside. It was very miserable. I wouldn't want to put one of my employees in that position to where they couldn't enjoy their family and they couldn't enjoy, their time off from work, that they, would be in pain like I was. It was not enjoyable. And if I can prevent that, then that's what my job is. They are listed here, the principles. Carry heavy objects close to your body. Stand erect. Make sure that when you're bending over, you bend at your knees. Avoid lifting anything from the floor. If you're going to push something or pull something, choose to push it and make sure you're pushing toward the center of it. Keep your shoulders up. Keep your back in the normal curvature. Don't be slumped over. That's going to put extra strain on your back that you don't need. And when you're going to pull from the head of the bed, if you're helping a patient up in bed, get to the head of the bed and pull underneath their shoulders. Use a draw sheet. Get them towards you. The foot of the bed should be elevated so that you're pulling them downhill. Don't ever stand on the side of the bed and try to pull. You're going to pull something on the side of your back, on the flank areas. We have policies in place where our employees do not get on the floor and clean on their hands and knees, where they don't move heavy furniture in patients' houses, where we're not standing on things to clean. Those are all, to prevent these types of injuries from occurring. But it never hurts to refresh our memory on those as well. Number 3, when employees are calling into the office, there are times when we're calling out. There are some backdoor phone numbers here. What I need you to know is those backdoor phone numbers should never be used by you to call into the office, because we have what's called a rollover set up on our phone system. When you call, everything comes into line 1. If there's no phone calls, line 1 lights up. If you call and you call line 1, it'll roll over to line 2, 3, or 4 if there are phone lines that are in use. Here's the problem. It's after hours. It's after 4 p.m. Monday through Friday. It's all day Saturday, Sunday. Someone's picking up the phone and they're calling a backdoor number, and it's ringing here at the office. No one's here to pick up the phone. When we transfer the phones, we only transfer line 1. Line 1 is 724-438-1936. Line 1 is also 1-866-566-9214. You must always call line 1. That line will transfer to the cell phone to the supervisor that's on call after hours and on the weekend. You cannot call the backdoor numbers. So, as a rule of thumb, don't ever call backdoor number. Always call line 1, which is 438-1936. And then you will get to speak to the appropriate person to help you. We want to help you. We can't help you if you're calling the wrong number. Okay? Number 4, Workplace Safety Committee and the PI Committee. Our Workplace Safety Committee is set up to review the safety forms, the home safety inspection flow sheets that are done on a monthly basis to several patients' homes. They actually complete some of those forms. We have supervisors completing some of those forms. The registered nurse on admission completes some of those forms. What we need is people that are interested in helping us with the Workplace Safety Committee or with the Performance Improvement Committee. The Performance Improvement Committee meets monthly, the same as the Safety Committee, for about an hour, once a month here at the Hopwood office, and we review policies. So, If that's something that you're interested in, if you have some input into some of the policies that we're presently uh, that are presently governing, our business, and you have some suggestions for improvement, or you would like to go out into patients' homes and complete some survey forms and bring them back to the office, please let us know if you're interested in that. It would take, you get paid for those. You also get paid to be here for the safety and the work performance improvement committee. If that's something that you're interested in, let us know, and we'll see if we can't rotate you onto those committees. Those committee members have to rotate every so often. Just throwing that out there for someone that might be interested. Next, number 5, our sexual harassment policy per our insurance company. We have to inform employees every year of our policy on sexual harassment, which is no form of sexual harassment is tolerated by Twin Oaks Home Care. This includes any physical or verbal sexual harassment as well as sexual innuendos. Any tasteless or immoral jokes from employees, clients, or their family members are also not tolerated. Twin Oaks Home Care will follow the disciplinary process if any employee is involved in any of these types of incidences. And depending upon the severity of the infraction, termination may be immediate. That would be at the discretion of the Twin Oaks Home Care management. It's nothing that can be taken lightly. It's something, we're here to protect every employee from being sexually harassed. That's our job, and that's our policy. Number 6, cell phone policy. Cell phones must be turned off whenever you're scheduled to work in the client's homes. Up until now, we've just had employees have their cell phones on vibrate, and you really need to listen to this because this is a policy change. Effective today, immediately, as of 4/3/12 at 11 a.m., any employee in a patient's home must have their cell phone off, because employees are there being paid to be there to provide a service to our clients. The state is paying for most of the care. Some of them are private paying. Some insurances are paying. When our employees are in the home, they're not to be playing games on their phone. They're not to be texting on their phone back and forth. They're supposed to be there providing the best care they can to a client. If there's a problem, your family members need to have the Twin Oaks Line 1 phone number so that they can get a hold of the office. The office will then in turn get a hold of you at that client's residence. Let's look at number 7. Number 7 is our Twin Oaks Home Care website. If you know anyone that is interested in applying, they can apply online. It's twinoakshomecare.com. If you're interested in our employees only section, there is a login and password that we can give you. You can go on there. You can view some videos. You can also look at some policy changes that we're putting in place and any up-to-date news that's occurring here at our company. Number 8 deals with our employee drug testing. There have been times in the past whenever we have had to drug test an employee. Drug testing is done randomly. It's on a case-by-case basis. We do not drug test every employee at Twin Oaks Home Care. If an employee's in a home and there are some pain pills missing from that home, we at that point would probably decide, okay, we're going to random drug test every employee that's in that home. The second thing that may cause us to decide to random drug test an employee is if an employee is at a home and the employee does something and they actually get hurt in a home. We may decide, okay, we need to see if the employee was, under the effects of something that would cause them to get hurt in a client's home. Then we would go ahead and drug test them at that time. Number 9, employee schedules. Just a reminder, basically don't call the office on Wednesdays for your schedule. Our employees, there's about 5 secretaries that are in here that are calling employees to give them their schedules. We're actually calling out. It's hard for us to call out if you're calling in. we will leave you a message to let you know that we've tried to get a hold of you. You're allowed to call in on Thursdays if you have not gotten your schedule as of Thursday. You did get one handout this time around. That is your 2012 pay calendar. If you have any questions about your 2012 pay calendar, please talk to one of the secretaries here at the office. Every spring, we mention the fact that we do have an insurance for our employees. It's called AFLAC. There are certain times when employees can sign up or opt out of these insurance plans. There's like a 1-month window. If you are interested in anything or more information regarding the AFLAC plan, please call the office and ask one of the secretaries about that. They will go ahead and provide you with any additional information that you need. And number 12, our Idlewild Park Day, we've been able to, for the last 7-8 years, take all of our employees and their families to Idlewild Park. We pick a day. Usually we don't pick a Monday because that's Bring a Friend Day and the park's way too crowded. Lines are real long. So we usually pick like a Tuesday either in June or July or in August that we pretty much just shut the whole agency down. And we would like for every employee and their family to come to Idlewild Park and spend the day there with us. The food, we provide a great deal of food. We enjoy seeing the children and allowing them to have a good time that day as well. We have it tentatively scheduled this year for July 31st. So for those of you that like to plan ahead, for those of you that would like to maybe buy some additional tickets for additional family members, brothers, sisters, cousins, in-laws, that'll give you an idea of when we're going to be going, the day we're going to be going. We always provide lunch for our employees there that day. That'll conclude the mandatory staff meeting for April of 2012. Thank you very much for coming in. It's difficult for us to keep everybody on the same page, but it's something that we have to do to stay the best home care agency in southwestern Pennsylvania. Thank you for all your help. And if you have any problems or questions with anything that we discussed today, don't hesitate to give us a call here at the office. Thank you.